Ladies and gentlemen, today we will delve into the fascinating world of lupus nephritis, a complex condition characterized by inflammation and damage to the kidneys in patients affected by systemic lupus erythematosus, SLE. Lupus nephritis represents a significant challenge in clinical practice, as it can lead to progressive renal dysfunction and poor long-term outcomes. Therefore, it is essential for us as medical professionals to gain a robust understanding of the mechanisms, manifestations, and management strategies associated with this condition. We begin our journey by exploring the mechanisms of immune complex deposition in the glomeruli of lupus nephritis patients. Immune complexes, comprising autoantibodies and circulating immune molecules, become deposited within the glomerular basement membrane, triggering an inflammatory response. Autoantibodies, such as anti-double-stranded DNA and antinuclear antibodies, play a pivotal role in this process. Moreover, complement activation, particularly through the classical pathway, contributes to the formation and deposition of immune complexes. Understanding these mechanisms is crucial for identifying potential targets for therapeutic intervention. In this video, we will explore the various classifications of lupus nephritis according to the World Health Organization, WHO, system. These classifications provide valuable insights into the cellular and tissue changes as well as clinical implications associated with each class. Class I signifies minimal mesangial lupus nephritis, while Class II is characterized by mesangial proliferative lesions. Class 3 and 4 involve focal and diffuse proliferative glomerulonephritis, respectively. Class V represents membranous lupus nephritis, and Class VI indicates advanced sclerosing lesions. Next, we discuss the factors contributing to lupus flares and exacerbations of nephritis, which significantly impact disease progression and patient outcomes. Various triggers, such as infections, hormonal changes, and exposure to ultraviolet light, can precipitate disease activity. Clinical manifestations of lupus flares include fatigue, arthralgia, rash, and renal symptoms such as proteinuria and hematuria. Management strategies primarily involve immunosuppressive agents, with a focus on balancing disease control and minimizing treatment-related toxicity. Another essential aspect of lupus nephritis is the pathogenesis and impact of tubulointerstitial inflammation. Inflammatory infiltrates within the renal tubules and interstitium contribute to renal dysfunction and prognostic outcomes. Tubulointerstitial inflammation can result in electrolyte imbalances, impaired renal concentrating ability, and chronic kidney disease. Identifying strategies to target and modulate this inflammatory response is crucial for preserving renal function and patient well-being. We now turn our attention to the involvement of podocytes, specialized cells within the glomerulus, in lupus nephritis. Podocytes play essential roles in maintaining the glomerular filtration barrier and preventing proteinuria. However, in lupus nephritis, podocyte dysfunction occurs, leading to increased glomerular permeability and proteinuria. Understanding the mechanisms behind this podocytopathy provides insight into potential therapeutic targets aimed at preserving glomerular integrity and preventing renal damage. A concerning complication of lupus nephritis is the association with renal vein thrombosis. Several mechanisms contribute to this phenomenon, including renal vein compression by inflammatory infiltrates and hypercoagulability associated with SLE. Clinical manifestations range from asymptomatic to acute kidney injury and venous thromboembolism. Awareness of this association is crucial for prompt diagnosis and appropriate management to prevent thromboembolic complications and further renal damage. Renal tubular acidosis, a distinct manifestation of lupus nephritis, deserves our attention. Acid-base disturbances, particularly metabolic acidosis, can arise due to impaired acid secretion and bicarbonate reabsorption by the renal tubules. These acid-base disturbances further contribute to electrolyte imbalances, such as hypokalemia and hypophosphatemia. Recognizing and managing renal tubular acidosis is vital for preventing complications and optimizing renal function in lupus nephritis patients. In lupus nephritis, dysregulation of the complement pathway underlies immune complex formation and tissue damage. Complement proteins, including C1q, C3, and C5, are involved in the opsonization and clearance of immune complexes. However, deficiencies and abnormalities in complement regulatory proteins can enhance the inflammatory response, leading to more severe glomerular damage. Understanding the intricate dance of complement dysregulation guides potential therapeutic interventions to mitigate tissue injury. Crescentic lupus nephritis represents a severe form of renal involvement, characterized by the formation of crescents within glomeruli. These crescents, composed of fibrin and proliferating cells, signify extensive glomerular injury and indicate a poor prognosis. Prompt recognition and aggressive immunosuppressive therapy are paramount in managing this life-threatening condition. Moreover, close monitoring of renal function and disease activity is crucial to improve long-term outcomes. An additional concern in lupus nephritis patients is the increased risk of cardiovascular disease. Multiple factors contribute to this association, including chronic inflammation, traditional cardiovascular risk factors, and adverse effects of immunosuppressive therapies. Recognizing and addressing these risk factors through lifestyle modifications, pharmacological interventions, and close monitoring is pivotal in reducing the burden of cardiovascular disease in this population. Pediatric patients with lupus nephritis face unique challenges in diagnosis and management. The impact of the disease on growth, development, and long-term outcomes necessitates a tailored approach. Monitoring disease activity, optimizing immunosuppressive regimens, and ensuring appropriate psychosocial support are crucial in improving quality of life and preventing long-term complications in this vulnerable population. Lastly, we explore the current state of lupus nephritis biomarkers and predictors of treatment response. Serologic markers, renal biopsy findings, and genetic factors provide valuable insights into disease activity and treatment response. Personalized management strategies based on individual patient characteristics offer the promise of improved outcomes and enhanced patient care. In conclusion, an understanding of the complex aspects of lupus nephritis, such as the etiology, clinical manifestations, and therapeutic strategies, is paramount for optimal patient management.